name's Brittany Christopher.
I'm Joel.
Caitlin Ward.
Amanda Jensen.
Molly Cunningham.
Julie Savage.
Sandy Fulkerson Schaefer.
Morgan Constantine Wimberly.
I'm 23.
32.
31.
24.
23.
23.
27.
29.
And I'm from Darien, Connecticut.
Minnesota.
St. Paul, Minnesota.
Utah originally.
North Carolina.
Damascus, Maryland.
Pittsburgh, Pennsylvania.
Austin, Texas.
One I knew I would probably want to do research again someday.
I'm really interested in doing research in reproductive health.
So much of my most recent career has been research oriented. I wanted to do something that would help me develop those skills along with the actual clinical skills.
I've always been a little bit turned off by Western medicine. To be honest, I'm just like, it doesn't quite gather the whole scope of caring for a person.
The United States healthcare system needs to be moving away from just fixing the problem. We need to be trying to prevent it from happening. And that's a lot of what public health teaches and looks at.
I like the idea of having kind of a social awareness when you're dealing with a patient because, nobody exists in a vacuum.
The main reason for me was the tie into reproductive health care. It's so difficult to look at an individual patient in reproductive health and not see the overarching themes that run in the community.
From an agricultural policy standpoint, I got really upset about some of the injustices of what is happening in terms of like obesity and malnutrition, both like globally and within the United States.
I always wanted to know more about climate change and more about disease trends. And I noticed that my education was really lacking in that, just doing like biology in undergrad. And I realized that I really wanted to know more about that before going out into the world and treating patients and before delving right into anatomy and physiology and everything.
I feel like lots of people choose to do PA and then they decide, let's also add on the public health. And for me, it was really the other way around.
Before I even thought clinical, I was kind of on a track for an MPH. And then when I went clinical and then I saw the opportunity to pair it with an MPH, I just felt like that was exactly what I should do.
Being able to speak the language of public health, being able to speak the language of medicine, and understand both enough that you can combine your care and make it more effective for a person and for people. So that's why, for me in my head, whether or not I did a dual program or I did a PA program and then a public health program, it was always going to be the combination, regardless. So I think this question is tough.
I don't know. That's a good one.
I think I am under the impression that initially I'll probably work as pretty much a PA and clinically until I get all of my loans and everything paid off.
Well, I plan to practice as a PA right away for a few years, probably not doing a whole lot of public health work, but who knows?
Lots of people who are dualers tend to start out working as a PA just to, sharpen those clinical skills, really establish themselves as physicians. And so sometimes that can be difficult to find a position. This is conjecture, but it seems like it might be hard to find a position that allows you to really hone in on your clinical skills and supplement it with this public health education right off the bat.
So it'll probably end up depending on where I work at first. I am not opposed to starting a research clinical job when I leave here, so that might be a way. But on the other hand, if I end up in a strictly clinical position, I'll just hopefully keep all of my training as my primary care and prevention treatment in mind when I'm working and talking with my patients.
I definitely want to do research with the patient population that I'm seeing, see if I can develop trends.
I think as of now, the MPH will definitely be integrated in research elements, as well as, if I do end up just practicing mainly here in the States, working on projects abroad as able.
I think later on I will possibly be doing research and within my community that I'm living.
I have various ideas kind of floating around in my head of like, when I work in a practice, we'll have like, we'll give out information about smoking cessation, and we'll have like free condoms, and we'll have all these things, which, might not happen, but it could. So maybe that.
So there's so much research in medicine, but I think sometimes providers have trouble sorting through a lot of it and finding out what would help their patients. So I want to have the skills to read a study and quickly pick out like, okay, how is this going to help me? What do I maybe need to change? I want to stay up on the latest changes in medicine, what's recommended, what's not.
I want to be a leader in my field in terms of presenting at conferences and just talking about general issues wider. So I think the public health degree will help enhance all of that.
I see myself both going into research. I would maybe consider going into higher education. I would definitely see myself as doing more interventions on a community level, and then perhaps my clinical skill set would make it so I could help interact with the individuals who are part of that like larger cohort.
My goal is that I would like to, expand my caregiving practice beyond those moments when patients come to me in whatever office I am, whether my office is, a hospital bed or an exam room at a clinic. My goal is to use my MPH to expand those moments to my patients' practices and health behaviors outside of the clinic and outside of the hospital. Whether or not I'm involved with that or if it's just kind of an educational component of my practice, I'm not sure.